Alan, what is the impact of IT on care?
Well, for us at Cerner, our main aim is to ensure that we're using the large amounts of data that are available effectively, but not adding additional process to the physician or the clinician's workflow, but using it in such a way that the data is available at the appropriate time as part of their workflow. So that's very important, and the content becomes a key feature as well going forward. How do you embed evidence into the practice of care? So those are two of the key things: the use of data effectively and good use of content, giving a means for evidence-based medicine to be practiced.
So what's new at the Cerner booth at HIMSS12?
We have a number of new features coming through at the booth this week, but primarily PowerChart Touch. Our new Millennium Plus application and PowerChart Touch is a key development which is gaining a lot of interest from a number of people. It's developed around the principle of fast, smart and easy applications. The initial 12 sites that are developing the solution with us at the moment are using iPads for that purpose. We'll be developing it on Android bases as well, and other mobile forms also. It really looks for very responsive times, 250 milliseconds or less, and it enables a very easy way to navigate through the patient record through the iPad in this particular instance. At a cloud level, a number of our applications are being used at the cloud and have been for some time. Research is a prime example of that. So how do you take the data that's available and generated as part of the patient record and actually ensure that you can then take what would be deemed to be best practice and feed that back at a much quicker rate into care. The evidence shows that it can take about 17 years for 50% of the physicians to adopt what's seen to be best practice, and that's the published evidence, and that's just too long. So being able to take that evidence and put it back into the record at an early stage is key for us, and we think we can do that within weeks, months or even less, working closely with partner organisations.
Talking about research-oriented possibilities?
Yes, so certainly great research-oriented possibilities for hospitals and organisations to engage in there. That's a big focus for us. It's also very important that we have other applications such as our semantic search application, which really uses crawlers in a sense to trawl through the patient record in order to have a degree of intelligence to pull out associated information for a patient event. One of the things that our doctors are telling us is that they don't want the embarrassing consultation with a patient. So if a patient comes back with a similar problem perhaps 4 years later and a doctor decides he'd like to prescribe a certain drug, a patient can say, but you tried that 3 or 4 years ago and it didn't work. What we're able to do now through using a semantic search is give them the tools to see very quickly exactly what has been used or what other associated or related episodes or events or treatments have been made for that patient, and that's available to them immediately. So that's a good development for us and a very important one. On the connectivity side, we continue to develop our CareAware platform, and being able to bring the infusion pumps and any other medical devices, the information and data from those devices straight into the medical record is again a great way to manage safety and improve patient care. And the benefit studies that we've had in a number of the sites adopting this technology is really showing that in terms of errors and outcomes they're getting improvements, and they're also finding a lot of more effective use of people's time. So of course when you're managing such a lot of data, it's really important that you present the information to the clinicians in an appropriate way without asking them to go through additional steps and processes. So again, it's very important that the solution becomes intuitive and provides them with the information that they require at the touch of the button.
So what's the situation of German hospitals with regard to best of breed?
I think it's widely acknowledged that in Germany the hospitals have very efficient processes and do exceptionally well managing patients' care, but best of breed still drives some restrictions in terms of how you can really optimise across the full care continuum. I draw an analogy, I guess, with the German car industry in the 90s, where at a process level all the efficiencies were there, but they were losing competitiveness. And when they started to look at the whole system, then that's how they regained their competitiveness. And that's what we're looking to do with healthcare. It's really to open it up beyond the walls of just a department or an acute unit, but across the whole care continuum.